Phew, there we go. Much of our identity is tied up in what we do for a living because if we're a full time employee in America, because some places in the world full time is actually shorter, but it's 40 hours a week. So we're spending a third of our life, give or take, almost about a third of our life um, at our job. So in a way, we can be defined by what we do, but it's not all we are. It's we aren't fully defined by our job. Now, this recently, I thought about. I generalize the medical profession. I tend not to trust doctors. I just, they're in it for the money. Basically, that's how I feel. We've got they see a patient, they go, so you can go. So you're with your doctor, even your primary care doctor, a lot of times for like 10 minutes. You'll wait for an hour. You talk to the nurse, answer all the questions the nurse has, and then the doctor just comes in and says, looks at you, takes your blood pressure, and okay, you're fine. They don't really, but and I think that's a generalization because if someone gets into becoming a doctor, going to medical school, it's not just about the money. They've got to be, their heart's got to be in it, in theory. I don't know. It's hard for me to ever get to know medical doctors. And I used to think it was because I haven't formed a relationship with them. And then the reason why you don't really form a relationship with doctors anymore is because, okay, for example, I have to use myself as an example. I went to OU Physicians for, I don't know, years, 5 or 6 years, because they were covered by my insurance. I would make an appointment at OU Physicians. The doctor whose name was on my prescriptions, Dr. Ray, I saw him like twice. I kept seeing somebody different. Every time you see somebody different. Every time you have to go over all of your ailments and it's all that getting to know you bullshit. It's all that really, maybe they do care where you work and how many kids you have, and maybe they care. I don't know. But when you have to go over the same thing with somebody different a month later, it's just like you're not really invested in our relationship. So how can I trust your medical advice? It just didn't do it for me. And this came, that's a generalization, all medical professionals. You know what I thought about, I think it's yesterday, because I saw a doctor on Monday, my podiatrist, and he is a foot and ankle surgeon. I don't know what else specialty is. It's surgery, foot and ankle surgery. He's got the diploma on his wall, and so he's a surgeon. And with the nurse asked me questions, and I go over, how has it been since you got the inserts, and if you've been going to physical therapy, she goes over everything. Okay, I'll see if Dr. Lashley wants to see you. So he comes in and asks me some of the same questions, but like a shortened form of the questions. And he gets on to me for not wearing the inserts. I stopped wearing them because it hurt my feet. You need to wear those because we don't want you to have to go to surgery. We don't want to see you in surgery, so you need to wear it. That's all I said. You got to wear those. We don't want to see you in surgery. Because even though your foot feels good now, well, I'm reading between the lines. He didn't actually say the same thing could happen you know, he did another stress fracture. He didn't really say that. Like, yeah, smile and nod, and then I leave, and I'm like, I'm not gonna listen to what he says. And he said to make an appointment. And I was like, I made an appointment, but I don't think I'm gonna keep it. I left there thinking this is just a waste of time and money. I had a copay to talk to him. Really? Then on Tuesday, I met with my physical therapist. So he had prescribed physical therapy for my, not just for my ankle, but also just for my legs, because what had been going on with my foot had to do with the distribution of weight. So they were trying to strengthen my ankles, and I have no arches, so I have to arch my foot a little bit, and I'm doing the exercises. I don't, to be honest, I don't do them regularly. But, okay, I was with this guy, Kevin, who I only saw 2 times before, I think. And then I saw Pablo like 4 times, I think. But he had me take my shoes and socks off, look at my feet and all this. And he asked me about everything, and I said that I wasn't wearing the inserts because they hurt my feet too bad. And he said, okay, you can get them adjusted. Maybe make them smaller. You need to, if you go half an hour a day for the first week, whatever, you got to get your feet used to that because we don't want it to happen again. And look at my toes. And on my right foot, my big toe is curved in a little bit. And I got calluses on my big toes. And he said, it's curved in because you don't have an arch, so there's nothing supporting your foot. So you walk the way you walk. It's all about distribution of weight, And he said, and he was telling me the things that, I got exercises that will help, will strengthen my legs and ankles. And he said he recommended. See, he didn't say you need to wear those inserts. He didn't get on to me. But it was like softer, almost like tough love, where he was convincing me. He says, I don't have skin in this fight, surgery or not. Because that's one reason why I told him. He's like, do you really, why aren't you doing what the doctor says? And I told him, I said, because he's a surgeon. He wants surgery. He wants someone to be in surgery so he can make more money. And it's just, so Kevin says, okay, I have no skin in this, surgery or not. I'm looking out for you. And he leveled with me, and I'm more apt to listen to him. And actually, I wore the inserts for till 7:20 today, which doesn't sound like a long time since my shift starts at 7 o'clock. But put on before 5, and I wasn't working, was on my feet. But I'm gonna get used to him. I decided because Kevin, he convinced me, and he's a physical therapist. Okay, I circle back around profession. Even though physical therapist is technically part of the medical profession, so different because therapists, their job is to listen and to talk and to basically tell you stuff that they know. They get knowledge, physical therapy. They get knowledge about how the body works, different things about how the body works. And it's their job to listen to you and to teach you, to tell. Doctors' job's just to make money, I guess. I don't know. It really is not clear. But see, the therapist, you form more of a relationship with the therapist because their professions set out differently. But you can't generalize. See, that's what I'm doing again. I'm generalizing physical therapists are better than doctors, but it's not necessarily the case. Some doctors are different. Some physical therapists are different. You don't meld with them. Some individuals, I'm talking about different kind of therapists, also like personal therapists. Um, if a client doesn't, their personality clashes with the therapist, they can't get anything out of it, out of the therapy. No matter how good the therapist is and listens and knows stuff and teaches and taught, it doesn't matter. They won't get anything out of it because of individual clashing. There's, I guess, part of my point of all professions. It's individual. It's not your professional. You aren't what you do. What you do for a job doesn't define who you are. Another kind of example of how it doesn't define the thing. This personality 5-star treatment has been a big deal right now because we're trying to make casino guests feel like they're treated great, 5-star treatment, really good. And they're making the focus on EVS, which is where I work. The janitors, pretty much, put a focus on how we have to start conversations and interact with guests and stuff. I think that will take away from our job. Yes, in the order of priorities, it's important that we be personable, but the highest priority for our job is to keep things clean, to go back through the area, pull the trash, make sure nothing's on the floor. That should be a higher priority for our job. But the person, an individual like me, say, I'm in this job. I'm really good at my tasks, my job. I'm good at keeping stuff picked up. My head is on a swivel. I'm always looking, when something needs to be done, I pick up. I am friendly. Somebody talks to me. I smile. I point, which is another, they don't like pointing. They want us to leave what we're doing and take them if they want to find where a restaurant is or whatever. I point. I am friendly. I talk to guests when they talk to me. If they ask me a question, if they say, where's the restaurant? And I'll be friendly and I'll smile, but I don't start conversations because that's not me. Define my job. I'm good at the tasks, but not the interpersonal relationship thing. It's not me, and I don't think it should be EVS. I think I'm doing it right. I think you should be good at keeping things clean. You should smile, be polite. That's all. But so I guess I'm kind of putting an opposite on the point of this. I'm defining somebody by their job in a way. I'm just like, they need to prioritize a different way. But there are people in my department who have outgoing personality. They're really bubbly, they're not limited by being a janitor. Stick that person in another job, they'll still talk to guests or customers or the public, however you want to put it. And put me in a different job, I'd still be task oriented. I still am. And that was one of the things whenever I worked in the call center. I knew the tech, I knew the stuff that I could describe how to install. I could describe how to program remote controls, but I lacked empathy. That's how they put it, empathy. I didn't talk. I didn't have a small talk. I didn't fill the spaces with fluff. That's what I consider just talking. Just talking to fill space. I would look at the problem. Okay, fine. I'd fix the problem and say, "Have a nice day." It's that's me. See, I'm not. I wasn't. I'm not defined by my job. I am. That's just how I am. And I think everybody's individual, and no matter what job they go into, that job will the job itself will change. You can't generalize and say all janitors are dumb and they're illiterate, and no, they're not all that way. I mean, it's just you can't generalize in that way. We had when I was little, so going way back. I got an uncle. I have an uncle who was in the medical field, and when anything happened, from a skint knee to a ear infection, we'd say, let's go ask Uncle Larry about it, because it was a medical thing, and that's we were we were kind of defining him like he knows about medicine, and wrong. He didn't work in an medical office. He wasn't a doctor or a nurse. He was a medical tech, a surgical tech. That's what it's called. He was around doctors, handing them their tools in surgery. But we falsely, there's a big fallacy there, we would define him as a medical guy. If we had any health related medical question, let's go ask Uncle Larry. That was stupid. And I learned that from a young age. So we